Hello, everyone. How are you doing? I'm Dr. Salvador Medina. Uh, Glad to be talking to you from my home in Tijuana, Baja California. Happy to be here with you. I want to thank Mayra for organizing all these live meets. Um, and first of all, I would like to talk a little bit about we're all set and ready to start working again. We're really happy about that. Next week, we're going to start reopen the office. We're going to start scheduling surgeries. Um, so we're really excited about that. Hopefully, you're excited too. Uh, and Very important, I would like to talk to you guys a little bit about what is going to change because of the pandemia, because of the virus, what's going to change about our scheduling and all the things that we're going to have to do to keep everybody safe. Um, should we go ahead with that, Maida, and start talking about that?
Yes, I think that there's always a lot of questions on social media about exactly what is the process, how should they prepare, right, during these times,
Mm-hmm.
and what is it that they need to prepare themselves, and how is the hospital gonna prepare itself?
Mm-hmm, mm-hmm. First of all, the scheduling, all the mechanism is going to be the same as it has been. You can contact us via email. Usually, that's the best way to start your evaluation. Uh, we're going to ask you for your general information, some pictures, what you have in mind, um, a general health survey of how you're doing, and from there we start. Uh, so we can see what you want and what we can do and what's best for you. We are going to add, besides the usual medical information that we need, some information about uh, a little bit of screening for COVID. If it's very important for you to be very honest with us, if you have or you had any symptoms that were like flu-like symptoms. If you had fever, if you had any coughing, if you have any other symptoms that could suggest that you had or have a COVID-19 infection, or if you knew somebody, you were in contact with somebody that you later on knew that he was infected. This is very important because if you do have any of these symptoms, it's very important for you to get a test, to be tested. Um, we have to start with that for you to let us know if you have any of these symptoms. And first, we have to do a better checkup to see if you don't have an infection. Uh, then, when we go ahead and schedule the surgery, we do the surgical plan, and we go ahead with this. When you come down to Tijuana into the hospital, we're going to do the regular lab tests that we always do. But then to screen for a possible COVID infection, we have two options. One is to be screened with a test, which has to be the PCR test or the swab. They're basically two type of tests. The swab, which is a PCR. I'm not sure if that's correct in English. PCR. I believe so. The other one is the immunoglobulins. We need the PCR one, the swab test, because that's the one that's going to tell us if you have an active infection, the active viral infection. We need this test at no more than 5 days prior to your surgery. You can do it wherever you have the facility to do it, no problem. Because we could do it here at the hospital. The issue with doing it down here is that it does take 3 to 5 days to give us a result. So it's very difficult to come down a week before your surgery to get the PCR test, stay for 5 days waiting for the result. So it's not very practical. So if you can do it at home and bring that test with you or send it ahead no more than 5 days before surgery, that's perfect. If you're not able to do this test, which I understand sometimes not that easy, and especially scheduling it 5 days before your surgery, what we're going to do is at the hospital, we're going to run a CT scan of your chest because the experts have seen that even in asymptomatic patients, we can see certain information with a CT scan that would suggest that you might have an active infection. If there is the CT scan comes back positive for these changes or the PCR test is positive, then we're not going to be able to go ahead with the surgery. We're going to have to focus on the infection, which means the surgery will not be able to do it. We'll have to reschedule it at least 2 to 3 weeks after that date. Okay, so um, we have to screen our patients before surgeries. That's very important. And if there's an active infection, we should not and will not go ahead with the surgery. Uh, about payments and all this, if you already made payments and suddenly it comes up that you do have an active infection, don't worry, we'll discuss about refunds. So that shouldn't be an issue. So we do have to do this CT scan. Of course, this necessarily will increase certain costs because we have to do this special test, which is not that it was not cheap. And also in the OR, for all the surgical team that goes into surgery, we're going to have special protective equipment for us. Uh, certain type of gowns, gloves, uh, face masks, etc. So of course that also, unfortunately, will increase a few costs. But we'll let you know beforehand what it is, how much it is, so you know perfectly well what that implies. But we will do these screenings. You come down either with a swab test or we do the CT scan. When we have these results and they're all negative, we go ahead with the surgery. The surgical team will have these extra precautions during surgery. Also, after surgery and the office visits, you'll see that there are certain things that we're going to change for your protection. So you can feel safe that we're taking all the measures needed for trying to keep everybody safe. Okay, so I think that's very important. That is going to change now after the COVID pandemic. Um, so basically, that's what we're going to do pre-operatively.
Wonderful, doctor. And one of the questions that we always get is how can they prepare these? You're speaking to those that possibly already have a surgery schedule, but what about those that are wondering, if I get post bariatric surgery, if I get a mommy makeover, how do they prepare? So if you could go, maybe we'll talk about the four main surgeries that you do, which are those that I mentioned, plus breast implants or lifts, and maybe a Brazilian butt lift. If you could just describe in summary, how should the patient prepare? There's lots of questions about should they drink alcohol, how long before they should stop, medicine, and so on. So I'll let you go.
Well, that's I'll go try and take it, make it a little bit simple. First, for your surgery, we have to schedule it whenever you're ready, weight wise, that you're at your good weight for the surgery, for a body contouring surgery. Once you're there, that I'll let you know if you're still not ready, you still have to lose a little bit of weight or not. After that, you have to be in a general good health. If you have other comorbidities like high blood pressure, diabetes, you have to be well controlled. We have to have evidence that your diabetes is well controlled. If you have a high blood pressure, it has to be well controlled. If everything's okay, that your general health is fine, very important, no smoking before surgery, before or after. Preferably that you don't smoke. That's the best thing, is that you do not smoke, because we get rid of a very important factor for very important complications. If you do smoke, you have to stop smoking at least 3 weeks before surgery and 3 weeks after surgery. That's very important. And that means not even one hit of the cigar or cigarette, nothing. The minimal amount of nicotine in your system will have a direct effect on the scarring process and the healing process. And I always know when we have a complication of the scarring process, when it's because of tobacco and nicotine. I can see, because there's very specific things that happen. So no smoking, very important.
Doctor, let me interrupt you.
Sure.
For those that's currently, in some states it's legal to smoke marijuana. Does this apply to marijuana, and does this apply also to the e-cigarettes?
Oh, well, that's a very good question, because patients think that because they are smoking e-cigarettes, it's not like smoking a regular cigarette. Well, it is. It makes no difference if you have an e-cigarette. I don't think if there are e-cigarettes free of nicotine. Almost all of them do have a certain amount of nicotine. Most of them have less nicotine than a regular cigarette, but they still do have it. And the effect is going to be exactly the same. And not to mention the pulmonary issues and complications that you can have, that we've seen that sometimes they are worse with an e-cigarette. But for your surgery, it's the same. E-cigarette or a regular cigarette. Exactly the same. About marijuana, the effect is a little bit different. It might not have that much of a drastic effect on your scarring process, but I would anyways recommend stop using marijuana at least 2 weeks before surgery, and preferably also a couple of weeks after surgery. It's not the same, but it's still good not to be smoking before and after surgery. So e-cigarettes, marijuana, or nicotine, basically the same. The worst, cigarettes and e-cigarettes. Not because you're smoking e-cigarettes, it has the exact same effect than a regular cigarette. So that's very important. We have to be sure that your nutrition is good, is correct. With some lab work that we do beforehand, we see your protein levels. If you have a low protein level, it also affects your recovery and the scarring process. That's why we always ask for you to send this lab work beforehand. Wherever you can at home, do this lab test, because there we can see your protein levels and also your hemoglobin levels, which have to be at a certain range. If either of those are very low, we should not go into surgery. Unfortunately, I've had patients that did not send the lab work beforehand, and the day before surgery, I see that they're anemic, and then we cannot do the surgery. Depending on what surgery and the level of hemoglobin, but if it's a big surgery that includes liposuction, skin resection, and your hemoglobin levels are not optimal, we do not do the surgery. And unfortunately, I've had to cancel a few surgeries. So it's very important for you to send us that lab work beforehand so we can avoid having that kind of situations. What else?
And regarding for someone that has low iron, how long does it take if they start to eat better and take some vitamins? How long does it take for the body to regain to bring the levels up?
Okay, that's a good question. I recommend everybody that's going to go a body contouring surgery, which includes liposuction, skin resection, to take a iron supplement at least 1 month before surgery, because it's a slow process and it takes at least a month to build up the hemoglobin reserves. So it's not going to be helpful if you start 5 days before surgery. It has to be about a month. And after surgery, you can keep on taking that iron supplement for another month. So it's good to take it before. If your hemoglobin level is normal, it will anyways help to take it. If your hemoglobin level is okay, 2 weeks before surgery, that's fine. If you're anemic, you have to start a treatment at least 1 month before surgery to have enough time for your hemoglobin to build back up, at least 1 month. So I do recommend, even if your hemoglobin levels are good, 2 weeks before surgery, you can start the supplement and then take it for a month after surgery. That's going to help you a lot with your recovery. So also before surgery, what else?
The other question that everyone asks is alcohol. How long before do they need to stop drinking alcohol, and can they drink alcohol post surgery? How soon after?
Before surgery, the truth is that alcohol does not have a direct effect on your recovery or your scarring process. I would think that you can take a glass of wine or anything a couple of days before surgery. The problem with the alcohol is that if you drink more than you should, it dehydrates you. So if you drink too much, get drunk, 2-3 days before surgery, you will go into surgery dehydrated. And then that has certain implications for me, for the anesthesiologist. We can catch up with fluids, but it's not the same. Then we have to administer a lot of fluids through the IV. Then you're going to get a little bit more swollen after surgery. So it's not a good idea to do that. So preferably no drinking 3 days before surgery. You could take 1 glass of wine. That would be okay, but no more than that. After surgery, you're going to take an antibiotic for almost a week. So it's not the best idea to be drinking alcohol while you're taking your medications, especially an antibiotic. So no alcohol for at least a week after surgery. After a week, again, you could drink a glass of wine, maybe a beer. That's it. Because if you drink more than you should, you're going to get dehydrated, and that will affect your recovery.
Wonderful. And another thing that people don't know and they should know is the team that you work with. You speak about we sometimes post them on your social media, but people don't know them. If you want to talk to them a little bit, explain to them how long you've been working with them and what each of the doctors do.
Yeah, I have a pretty nice team. that we always go into surgery together. We've been doing this with Dr. Hector Acosta. He's my anesthesiologist. I've been working with him 6 years now. He's a great guy and a terrific anesthesiologist. He really cares for his patients. He likes to take his time and talk to you before surgery, explain what's going to go on, to see if you have any questions, so you can go into surgery at ease and not worried about the anesthesiology, the anesthesia. He's a very well trained anesthesiologist. He's been doing plastic surgery anesthesia for a very long time. So he has a lot of, he's young, but he has a lot of experience. I've been with him when he reacts to difficult complications, and he's amazing to resolve everything. Amazing. So I trust him 100% with my patients. He's a great guy. He's really nice, and he's a very good anesthesiologist. And I always go into surgery with another plastic surgeon. There are some plastic surgeons that they work by themselves, or they work with somebody that helps them, but it's not a plastic surgeon. So I go into surgery with another plastic surgeon, Dr. Carlos Marciales. He's also a great guy. He's a good friend. He's a great plastic surgeon. He helps me, I help him. We both help each other during surgeries. Even though I'm in charge with everything during the surgery, he is the one that helps me with everything. So between both of us, we do the surgery. He's very skilled. He's very good. He's from Venezuela, and he was trained in Mexico City as I was. He's a little bit younger than I am, but he's also a very good surgeon. He works almost exclusively, also like me, with massive weight loss patients, so he has a lot of experience with that. And we have a team of nurses that always are in the OR assisting us. So basically, those are the two that are with me in every single surgery, and I think we do a great team.
Great. So I think that most answers most of the pre-surgery questions. And now, just again in summary, just so that people can understand, how long does it post-surgery? Do they have to be off work? Do they have to be off work and no exercise? If you want to speak on the major surgeries that you do on those two subjects.
On a regular basis, on almost any kind of surgery that we have, could be mommy makeover, a lower body lift, breast surgery, implants or a breast lift, usually also facial surgery. The most important part are the first 2 weeks. Those are the weeks that we have to be very careful, take care of our scarring process. That's when we can have certain complications with wound openings if we do certain movements that we shouldn't. So first 2 weeks, no physical efforts. You can't be bending, stretching, lifting, anything. No driving. So that doesn't mean that you have to be sitting or laying down. On the contrary, you have to be up and around, moving, walking. You can go up and down stairs carefully, but you can do it. But no efforts, no lifting anything, nothing. 2 weeks. After 2 weeks, you can start stretching a little bit, bending a little bit. You can start driving. You can start lifting light objects, moving a little bit more. After 4 weeks, the scar should be basically healed. Sometimes there are certain areas that don't close completely at first, but there's smaller areas. So you should start to do full range of movements after 4 weeks. Exercise, depending on what type of surgery you had and what exercise you do, 6 to 8 weeks. We usually start at 6 weeks and progressively go up until 8 weeks. You can start doing any kind of exercise. That's basically how the recovery goes for the first month, 2 months. So depending on what job you have, what you do, if it's a desk job that you just have to sit and take it easy, sometimes after 2 weeks you could go back. If it's a more physically demanding a job, 3 to 4 weeks, because before 2 weeks, absolutely no stretching, no driving, nothing. So depending on what you do, could be at least 2 weeks. That's what I would recommend. Or if you just have to, you can be sitting down at home. Well, maybe you can do it a few days after surgery. You're going to feel, depending on the type of surgery, you're going to feel a little bit sore, a little bit tired. So let's say 2 weeks after surgery, you can start working. Depending on what you do, could be 4 weeks to go back to work almost full time.
Great. And then lastly, for those that joined a little later, if you want to remind everyone that when the office is open, and if you could speak a little bit on the discount that you're offering for anyone that books for these upcoming months.
Yeah, sure. For the people that just joined us, we're very excited that we're going to start reopen the office next week, starting June. We fortunately already have surgeries scheduled. And from there on, whenever you feel comfortable, scheduling your appointments or surgeries. What's the other question that you said, Maida?
If you could just talk about the discount that you're offering.
The discounts. Yeah, because I mean, after what we're still going through, and we went through, we get it that economically it's been difficult for almost everybody. So we're offering a 20% discount for whoever schedules their surgery June and July. If you schedule it now, June, July, you'll get a 20% discount.
Wonderful. So let me read the questions. We had one. Oh, it wasn't a question. It was a hello from Jennifer Williams. You want to say hi to her?
Hello.
And
thank you for contacting us.
Yes, she says hello. And then all the other questions we answered throughout the stream, so we're good. And again, for anyone that has questions, I'm going to post your email if they want to book an e-consult. It's right there on the screen. Mm-hmm. And hopefully we could do this in the next 2 weeks. So look for our our post on Facebook.
Perfect. Okay, so
great.
Thank you everybody for being here with us, and we'll see you soon. 2 weeks, we'll do this again, and contact us. My email. Any questions? I'll have somebody, my surgical coordinator, Aura, or Maida, contact you, send you all the information that you need, send us all the questions that you have so we can start scheduling your procedures. Thank you very much.
Great.